Now, across sub-Saharan Africa, including Ghana, the true toll of sepsis remains hidden, buried under poor documentation and limited awareness. Sepsis is a deadly response to infection, yet without accurate data, health system cannot fight it effectively. Now, a regional group, Sub-Saharan Consortium for the Advancement of Innovative Research and Care in Sepsis, is urging swift action to change that. Clinton Yeboah reports.
Over 50 million people with infections progress to sepsis, of which 11 million are unable to survive. Sepsis is a disease condition in which the body's response to infection is so extreme and rigorous that it starts to damage or harm itself or organs of the body. Normal infections like malaria or diarrhea can progress into sepsis and can damage the brain, lungs, kidneys, and the immune system. According to Dr. John Appiah, Principal Investigator of Sub-Saharan Consortium for the Advancement of Innovative Research and Care in Sepsis, STARS, compounded effects of sepsis are borne by low-income countries.
So we are bearing the most brand, and you know that our health systems are also weak to handle sepsis. Sepsis on its own, treating sepsis means you need to have the resources to be able to manage the organ which is failing. So if an organ is failing, like the kidney is failing, like the lung is failing, you need machines that can help sustain the person's life till the drugs we are giving works. So that's the reason why we show that the burdens and then the fact that we also don't have the resources to be able to manage them.
Without accurate data, hospital managers, doctors, nurses and policymakers struggle to allocate resources, develop treatment protocols and address the crisis effectively. STARS aim to conduct high-quality research addressing critical knowledge gaps in the epidemiology, diagnosis and quality care of patients hospitalized with sepsis in resource-constrained settings in the region. Speaking at a sepsis capacity building event in Kumasi, Dr. Appiah indicated that the research will help bridge documentation and information gaps of sepsis conditions.
So for us to understand the real problem in terms of numbers, the extent to which people are suffering from sepsis, we need to start documenting, counting them, so that at the end of the year we can reliably say these number of patients suffered from sepsis, this number of patients died as a result of sepsis. Even with that, it will help our policy makers, our hospital managers, our doctors and nurses to be able to understand, put resources into managing sepsis.
The STARS Forum assembled healthcare practitioners, pharmacists and media personnel. Regional Vice Secretary of the Chemical Sellers Association, Gladys Appiah Bedu, says the awareness and training will inform the operations, especially over-the-counter pharmacies.
The awareness has come. We have been taught today that we shouldn't just sit down and say maybe things that we have been trained for, like simple malaria and other things, are just like that. Right now, we are going to inform our people to wake up, and then we give the information to other. We have 27 districts in Ashanti region.
For Joy News, my name is Clinton Yeboah.